Type 2 diabetes is a metabolic disorder characterised by high blood sugar levels due to insulin resistance or insufficient insulin production. It's a growing global health concern. And while diet, exercise and medication do form the cornerstone of diabetes management, researchers are continually exploring new avenues to improve blood sugar control. And one such area gaining traction is the use of probiotics that can alter gut and metabolic health. But can these tiny microorganisms make a meaningful difference for people with type 2 diabetes? Let's dive into the latest research. The gut microbiome is one of the hottest of research topics today. It seems that almost daily we are learning more about how what is happening in our gut and the microbes that have colonized it can affect our health. One of these metabolic health links that has emerged is glucose metabolism. People with type 2 diabetes often show alterations in their gut microbiota composition, with a decrease in beneficial bacteria and an increase in potentially harmful ones. This dysbiosis, as it's called, can contribute to inflammation, insulin resistance, and impaired glucose regulation. All the classic hallmarks of type 2 diabetes. Probiotics aim to restore this balance. Probiotics, which are defined as live microorganisms that confer a health benefit when taken in adequate amounts, have shown promise in modifying the gut microbiome. By introducing beneficial bacteria, probiotics may help to restore balance to the gut ecosystem and potentially improve metabolic parameters such as glucose regulation. Now, I won't delve too much into just how they may do this, as there are many pathways involved. But one such mechanism is through compounds produced by this bacteria when they ferment prebiotics that are called short-chain fatty acids, which influence insulin sensitivity, inflammation, and even appetite. So the big question, how strong is the evidence for the use of probiotics in managing the dysregulated blood sugars seen in type 2 diabetes? A recently published systematic review and meta-analysis set out to answer this question by examining the effects of probiotic supplementation on glycemic control in adults with type 2 diabetes. The researchers scoured multiple databases to find relevant randomized controlled trials that could help to address the question. All up, the analysis could include 32 studies with a total of over 1,900 participants with type 2 diabetes. The probiotic interventions varied across studies with different strains, dosages, and durations of supplementation. In most of the trials, though, the probiotics given were from the Lactobacillus or Bifidobacterium genera. The primary outcomes of interest were changes in fasting blood glucose, HbA1c or glycosylated hemoglobin, which is a measure of long-term blood sugar control, and fasting insulin levels. And I'll link to this study in the show notes. So what did they find? The results were quite promising. Probiotic supplementation significantly reduced fasting blood glucose levels compared to placebo, with an average reduction of 0.7 millimoles per litre. There was also a significant reduction in HbA1c, with an average decrease of 0.44 percentage points. So both of those numbers I've mentioned are certainly clinically significant for someone with type 2 diabetes. And also, it was positive to see that fasting insulin levels also showed a trend towards being lower, although this didn't quite reach statistical significance. But there's nuance in the results. For a start, dose and duration mattered, with longer interventions greater than 12 weeks showing stronger reductions in fasting glucose levels. And it seems that strains mattered too, with mixtures of Lactobacillus and Bifidobacterium performing best, but results varied. And it's important to note that while these results are encouraging, they should be interpreted with some caution. The quality of evidence varied across studies, and there was significant variation in the probiotic formulations used. This makes it challenging to pinpoint exactly which strains and dosages might be most effective. So, should someone with type 2 diabetes try probiotics? The data is promising but not definitive. Here's what to consider. Firstly, strain selection. Look for products containing lactobacillus or bifidobacterium species, which showed the most consistent benefits in the research. And patience pays, as benefits emerged after 8 to 12 weeks, so consistency in taking the probiotic is key. And importantly, individual responses vary. Gut microbiome composition is different between people, so a probiotic that works for one person might do nothing for another person. And the final and most important point is that probiotics are not a standalone fix, but instead should be a complementary strategy, not a replacement for diet, exercise, or prescribed medications. And anyone with diabetes considering adding probiotics to the diabetes management plan should consult with their healthcare provider to ensure they're selecting an appropriate product and using it safely, especially if they are already taking medications designed to lower blood sugar levels. So let's wrap all this up. While probiotics show promise as a complementary approach to improving glycemic control in type 2 diabetes, they're certainly not a magic bullet. The foundation of diabetes management still rests on a healthy diet, regular physical activity, and appropriate medication use. Because those first two factors of diet and exercise will also positively influence the gut microbiome on their own. It's all related. Probiotics may offer an additional tool to support these efforts, but they should be viewed as part of a comprehensive approach to metabolic health, not a standalone solution. So that's it for today's show. You can find the show notes either in the app you're listening to this podcast on, or else head over to my webpage at thinkingnutrition.com.au and click on the podcast section to find this episode to read the show notes. If you find this podcast of value, then please consider sharing it with your friends and colleagues. This all helps to increase the reach of the podcast, which means a big win for credible, evidence-based nutrition messages and making the world a slightly less confusing place. I'm Tim Crow, and you've been listening to Thinking Nutrition.